May is the month when we celebrate mothers and women's health. And one topic many women don't talk about much is their pelvic floor health. Most women only think of it after having a baby. Some say they have pain and other issues months after giving birth. So joining us today is Dr. Uchenna Osai from the Women's Health Institute at UT Health Austin. Thank you so much for being with us this morning, Dr. Osai.
Thank you.
I just want to start out by talking about, what exactly the pelvic floor does and how it can affect women after they give birth.
Absolutely. So the pelvic floor are the muscles at the bottom of our pelvis, right? And they're part of our core muscle that we all work so hard to get strong. And its primary job is to stabilize our spine and keep our organs inside of us, but it also helps us with bowel health, bladder health, as well as sexual health and childbirth. And oftentimes people forget that this muscle even exists. So when you go through childbirth, you don't realize there's a problem until later.
And what are some of the conditions that might occur once you give birth, and then when should you seek care for
Absolutely.
those?
So oftentimes people have low back pain, pelvic girdle pain, but then they also have urinary incontinence, fecal incontinence, and even pelvic organ prolapse or pain with intercourse. So I always tell my patients that what they want to do, especially when they're planning to have children, is that if they have issues, they want to get this addressed before they get pregnant, because it's a lot easier to get things addressed.
Are there any steps you could give women to try and address some of these issues before getting pregnant?
Absolutely. Well, first, acknowledging that your pelvic floor exists, because we're not taught this in school, right? And once you know that you have a pelvic floor, incorporating and training that with all of your other muscles, because it's just as important to address those muscles just like we do our abs, our glutes. And if you have pain issues, you definitely want to get those addressed as well.
All right. Well, thank you, Dr. Osai, so much for being here with us this morning. We appreciate it. And here at KXAN, we're committed to helping you learn about your health along with our partner, the American Heart Association. So for resources and easy tips to live healthier, just go to KXAN.com and click on the Simple Health tab.